Hi there, welcome back. Why don't we just practice OET listening part A together? Let's get started. So we have already done videos based on listening part A, OET listening part A, as to what the format is, what are the do's and don'ts. All of these have been covered in our earlier videos. Now in this we are going to just take a sample and try it out. Before that, let's quickly recap the format and the type of questions, all those details. Okay. So, you know that in part A of OET listening, what you get to hear is healthcare consultation. That is, you will be hearing conversation between a patient and a healthcare professional. And in part A, you'll have two extracts, and each extract will be based on an audio recording, that is a healthcare consultation. You'll listen to two healthcare consultations, and for each healthcare consultation or based on each healthcare consultation you'll have 12 questions, which means that in part A in total you'll have 24 questions. Okay, and what kind of questions you get in part A? They are completion questions. That is, there would be gap spaces given in the question and you need to fill in those gaps as you listen to the audio. That's what happens. Now I'll show you a sample. Before we get into the actual test, I'll just show you a sample. You can see it on the screen. And to understand, just to quickly recap how the structure and format is and what are the things that you need to bear in mind before you do the test for part A. Okay, so it'll be given like this. You hear a physician talking to a new patient called Mr. Peterson. For questions 1 to 12, complete the notes with a word or a short phrase. So who is going to be that healthcare professional? That is, it can be a physician, a dentist, or a neurologist, whoever it is. That healthcare professional's designation would be given, then the patient's name would be given, and the question numbers which you need to focus on would be given. That is, initially it will be 1 to 12 for the first extract, and as you move on to the second audio recording you'll have to focus on questions 13 to 24. Okay, and the instruction, so you hear a physician talking to a new patient called Mr. Peterson. Now why this is given? For you to understand the settings so that you can accordingly activate your background knowledge. Okay, but your medical knowledge will not be necessarily needed here, but still you can expect what kind of words you may get in the audio by understanding which healthcare professional is talking to the patient. Okay, and then the instruction given here is for questions 1 to 12, complete the notes with a word or a short phrase. That is important, which means that you have to fill in. You can see the gap spaces here, 1, 2, 3 numbered, 1, 2, 3, 4, 5. I've not shown all, 1 to 5 is shown here. So you need to fill in those gaps using a word or a short phrase, which means that your answers in part A cannot be lengthy. A word, mostly it would be one word or maximum of 2 to 3 words. That's what you mean by short phrase. And then what is given here? You now have 30 seconds to look at the notes, which means that before the actual audio recording begins, that is the recording pertaining to the consultation starts to play, you will get 30 seconds to analyze the questions 1 to 12 or 13 to 24 accordingly. Okay, now you have to make use of this time. How to utilize this time effectively? I'll tell you. So you can see some information, they are highlighted. So such highlighted information you have to make a special note of. Okay, and then under each of those subheadings details are given and you have the blank spaces in between them which you'll have to fill as you listen to the audio. Now during the 30 seconds what you need to do, I would say these are the things that you need to keep in mind. First is analyze and predict. Now what do you mean by analyze and predict? That is, you have to analyze means understand the question basically. Read the question, read the subheadings. You have to understand and predict. Predict as in you cannot predict the exact answer, but you can guess the type of answer that can appear in some of the blank spaces. Even though not all of them, some of the type of answers we would be able to guess if you analyze or understand the question. For instance, the first question, patient reports experiencing chest discomfort mostly during. During means it would be time, right? Maybe during day or maybe while driving. So such instances should come to your mind. Okay, now it cannot be, for instance, sometimes students think that in the audio you hear that The healthcare professional is asking the patient, how long have you been experiencing this chest pain? So the patient replies like, I've been experiencing this for the past 2 months and I notice it mainly while driving. Now, sometimes some students, as they hear that I've been experiencing this for the past 2 months, during they write 2 months. During 2 months. Now, is that logically correct? You just read the sentence, patient reports experiencing chest discomfort mostly during 2 months. Does that make any sense? Obviously not. So what you need to understand, analyzing is understanding the question and predicting the type of answer that can come in this blank space. Suppose if the patient's reply is, I've been experiencing chest pain for the past 2 months after or especially while driving. So while driving means it is during driving. So the answer would be driving. Now that is what you mean by analyze and predict. Analyze the question, understand the meaning of each of the word in the question and then predict what would be the type of answer. Not the exact answer, what would be the type of answer that can come here. So during is an important word that we have to take into consideration to understand what type of answer might come in that blank space. So analyze and predict is that you have to understand the question and guess the possible type of answer. Then underlining the keywords, that is another important thing that you should be doing during this 30 seconds. Now for underlining keywords means not underlining the complete set of questions, no. Keywords mean those are important words which will actually help you in leading towards the answer. Now describe the pain as. When you say describe the pain as, it means that it indicates the type of pain. It can be, describe the pain as a dash sensation. So the feeling, that is what being asked here. So it can be like throbbing, electric shock, whatever it is. So and again, how do you understand that? By reading this, the words surrounding that blank space. Describes the pain as dash sensation. That is how you identify or what could be the probable answer. So as you listen to the audio, you will not have time to again read these questions in detail. So that's why we are underlining the keywords and keeping it in prior before the audio begins. And now let me tell you that during the 30 seconds, you might not be able to cover all of those 12 questions. You might not be able to analyze all the 12 questions. Those are really good at it, maybe who have practiced a lot of listening and who can read quickly may be able to underline all of those keywords. But you might not be able to complete all of those. That's fine. How much ever is possible from your end, try and do that. Now the second thing is that underlining the keywords. That is another thing that you should be during that 30 seconds time. Then be prepared for synonyms. That is, as the audio begins or even before the audio begins, you need to keep in mind that I'm not going to hear the words, the exact words as you see in the question booklet in the audio. The synonyms of those would be mostly heard from the audio, which means that if I see this word sensation, I should not be actually focusing on to listen the specific word sensation. I might not hear the word sensation. You might be hearing something like feeling, which again means the same. So you should be open for synonyms. That is another thing that you have to keep in mind. Then do not paraphrase or use abbreviations. Now paraphrasing, you have to understand that of course this is a language test which assesses your language skill. But this being a listening test, you should not be paraphrasing and showing your skill. You are supposed to showcase your listening skill, how well you are able to listen and understand a specific word and apply it as the answer. Okay. So now if you hear, for instance, suppose if you hear the pain as, describe the pain as dash. You hear the patient saying severe, and I thought that why should I write severe? Let me show my language skill. Let me write it as intense. No, then your answer goes wrong there. You are supposed to write only what you hear from the audio. In the audio, the words would be paraphrased with regard to the words you see in the question booklet. But when you transfer when you record the answer onto this question booklet or rather answer sheet, you should not do any paraphrasing. You should write what you hear from the audio exactly as such. No modifications are to be made. Do not paraphrase or use abbreviations, which means that you're not supposed to use short forms. For instance, has a family history of hypertension or has the patient says that yes, there's a history of blood pressure. Now you're not supposed to write BP here. You know that BP means blood pressure, but you should not be writing any short form by BP or hypertension, HTN for hypertension, no. Because what you have heard it as hypertension or blood pressure, which means that you have to record the answer in the same exact way. No abbreviations are allowed, no technical terms, no abbreviations, nothing. Then don't repeat words or synonyms of words from the question paper. Now, like sometimes this happens with a lot of students, I must say. You listen to the audio you carefully and you understand the answer, and they would be hurrying to write the answer. But sometimes they don't read what the surrounding words are surrounding that specific question, and they tend to repeat the words which are already there in that sentence structure. For instance, look at this. Notes feeling unusually tired and short of breath after walking a few dash. And you hear in the audio like I experienced shortness of breath just by walking some steps, or just by walking 10 steps. So what would be the answer here? Can I write walking a few 10 steps? No, I should only be writing steps here, because instead of few they have used 10 in the audio. That you need to understand. So whenever you note down an answer, you just need to, like when you get time at the end of the listening test, you will get 2 minutes. So during that 2 minutes, your focus should be on listening part A. I would say so, because part B and part C, as you know, they are multiple choice questions, and you cannot analyze or you cannot rectify it, because they are multiple choice questions and you don't have anything there once the audio is done with. But when it comes to part A, even though you don't have the audio here, you can check for the correctness of the answers that you have marked in part A. This is one such instance. Like if you write notes feeling unusually tired and short of breath after walking a few 10 steps, no, that does not make any sense. So you don't need that 10. Instead of 10, what they have given in the question is few, and in the audio they have mentioned as 10. So you should be only writing steps. That is what this point means. You should not be repeating the words or synonyms of those words, or something which has the same meaning, more or less the same meaning as they say in the audio. If it is there in the question, you should not repeat those words. Okay, then the sentence becomes meaningless. Then spellings. Spellings are of course important, especially for words which are very common, which you use in your daily life, or whatever for that matter, any word. You should not make spelling mistakes. Spelling mistakes are going to reduce your score. You won't get half mark. If your answer contains a spelling mistake, then you will be getting 0 for that specific answer. Then article, the use of article. For instance, like word articles, indefinite article like a, or definite article like the. Now, the articles, if you use or if you don't use, it's okay. They are not a major concern. You may or may not use them. Okay, articles. For instance, here, doctor plans to schedule an ECG and possibly a CT. In the audio, you hear it as a CT. Now, if I write a CT or just simply CT, both are fine. Articles are not a major concern. Then singular or plural, you have to take them into consideration. For instance, here, this instead of steps, if you only write step, then the answer is considered as wrong. If you hear it as plural, it should be recorded as plural itself. If you hear it as singular, it should be recorded as singular itself. And moreover, like only then the grammatical structure of the sentence would be correct. See here, it's already written a few. When you write a few, of course it is more than one. So if you write step, then it's not giving grammatical correctness to that sentence. Okay. So singular and plural, it is important. Spellings are important. Articles are not that important. Then be specific. Now be specific, by what I mean be specific is that now for certain instances, like if you have to mention body parts, if the body parts they appear in pairs, for example eyes, legs, hands, In the audio, if they mention it as left hand or right hand, you have to mention it as left or right itself. You cannot simply write hand, because being healthcare professional, this is a note which is being prepared by the healthcare professional. You have to be very specific. So body parts which come in pairs, you have to clearly say whether it is left or right depending on what you hear in the audio. You cannot, if you hear left knee in the audio, you have to write it as left knee, pain in the left knee. You cannot simply write knee. And for left knee, you cannot write L knee. Again, a short form cannot be used. That is also wrong. Left knee, you should be writing it as left knee itself. And you cannot write it as knee alone. That is again wrong. When you hear left knee as such. Then another thing, the most important thing is being legible. Your handwriting should be legible. No matter how good you are at listening, how well you are with the accent, you're able to understand British, American, Australian, all of those accents at ease. You are very good at, critical thinking or whatever it is. You can understand all of it very well. But your handwriting is not legible, then will that serve the purpose? No, you're not going to get marks. So make sure that you write in a legible way so that the examiner can understand what you have written. Only then you will be getting this scores. Okay. Now this is just the overview that I've given you before getting into the actual practice test. Okay, now with that overview, let's try solving a listening test together. Okay, part A of the listening test. I'll play the audio right from that 30 seconds time. You'll be listening to the audio during that 30 seconds time, as I've already mentioned what we should be doing. Go through the questions, then analyze and predict. You can predict the possible answer, or at least underline the keywords so that you know what kind of answers might appear in those blank spaces. And then as the audio begins, try to fill in with those right answers. So let's get started.
Extract 2. Questions 13 to 24. You hear a hospital neurologist talking to a new patient called Kathy Tanner. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Tanner. Pleased to meet you.
Hello.
Do you mind if we start off by getting some background to your condition? Just in your own words, could you talk me through the reason you're here and how it all started?
Oh, please call me Kathy.
Right.
So, until 2 years ago, my husband was in the army.
Right.
We lived off base, and I had a job which involved a lot of driving.
Mm-hmm.
Whenever I was in the car, I noticed that my neck would get pretty stiff at times.
Right.
It was hard to turn my head. To cut a long story short, when my husband left the army, we moved to a new house. My neck pain was still a problem, so I decided to visit an osteopath.
Right.
He tried to fix the problem by a neck adjustment, but actually it just made things worse.
Oh dear.
I found I was losing flexibility in my neck. I began to use a heat pad, which did help at first.
Good, but was not for long?
No. About a month or two on, I started to get this sort of feeling that something was pulling my head over towards my right shoulder.
Right.
It was painful and embarrassing because I couldn't keep my head straight.
Of course.
I'd managed to hide it from everyone around me until then. About this time, one of the doctors I'd seen thought physiotherapy might help and sent me to a nearby clinic.
Mm-hmm.
So I started going in regularly for treatments. And one day, the head of the clinic looked at me while the therapist was trying to position my neck and whatever. And he said, "You know what your problem is, don't you?" And I replied that I didn't. And he told me that I had spasmodic torticollis, and I had no idea what that was.
So what happened then?
So he says, "Oh, it's untreatable. You just have to learn to live with it." I went home in pain, feeling depressed and hopeless.
Yes, of course.
He was just so unsympathetic and unhelpful.
Well, I'm sorry to hear this.
Thanks. So, my diagnosis of spasmodic torticollis was in June. So I began to research, what I could do. I tried chiropractic treatment until December. It cost a fortune, but did no good.
Oh, dear.
The pulling and pain continued to increase. I saw a couple of neurologists, and I was put on a drug called baclofen, but it really didn't make any difference.
Yes, that wouldn't do much for your condition.
Oh, right. Anyway, the one really good thing I did at that time was to join a support group for spasmodic torticollis patients, so at least I knew I wasn't alone with the condition. But mostly, I just sat at home a lot. In order to get a bit of pain relief, I got myself an orthopaedic chair, and that did give me some support.
Right.
In November, I saw something in a magazine in the medical section. It mentioned some new treatments being done at the university hospital to treat things like spasmodic torticollis with Botox. We mentioned this to our GP, got a referral, and in December, I had the first injection in my neck.
And how did the treatment go?
Well, the injections really helped the pain, My head returned to almost a normal position.
Right.
It did give me a few problems, like problems swallowing, but that was okay. I thought I'd received a miracle cure. I was devastated when everything started to come back like before, and I went back to the hospital in May. At this time, the results weren't quite as good. Even though they'd upped the dosages, I ended up having 9 lots of injections, plus the, various oral medications. So I can't remember what they were.
No, it doesn't matter.
But nothing really made much difference. I just got more and more confused, and loss of memory became a problem too. Just for pain relief, they ended up giving me a pump so I could give myself morphine. Finally, I saw something in my ST support group's magazine about a relatively new type of surgery being done by a local neurologist, and that would be you. So here I am.
And we will do our best to help you. Now, just a few more questions.
Okay, with that, we have completed this section. See, please make a note of the question numbers. Like in the question, it appears at 1 to 12. Please bear with me. It's 13 to 24. Okay. Now, how did you find it? Did that analysis during the 30 seconds, did it help you in identifying or predicting the type of answer, and how well you navigated through the questions using the keywords that you have underlined? Whatever we have discussed initially should have been applied here, and then I think it would have been, or it should have been, an easy task. If any area of confusion in any answer, I don't think so. Let's go through them one by one quickly. So this background to condition, that is the first subheading, and you need to focus on that, which means that the patient would start talking about the background first. Experienced discomfort, and experience means definitely the patient would be talking about a symptom that she has experienced. Now discomfort, along with discomfort, what did she experience? Then one mistake that students make here is that some write stiffness and a stiffness, discomfort and a stiffness, they do write. Okay, that would have been right if this word feeling was not here. We don't say that I experience discomfort and stiffness feeling. No, discomfort and stiff feeling. If the word feeling was not here, then of course you can write experience, discomfort and stiffness. Okay, more than that, you heard the word stiffness as stiff as such in the audio, so definitely stiff itself is the right answer. Then when they hear mentioning in the audio the word osteopathy, you can tick that, which means that why did I tick that is because I'm tracking the audio so that I know where the audio has reached now, and accordingly I can relate it to the questions. Then used is a keyword, used something. So it can be any product, it can be anything which the patient used to relieve the symptoms in neck. It can be a medication, it can be a product, a medicated product. So we have to look out for that. What is the patient going to mention as she used something which helped her in relieving the symptoms. Now before mentioning of this heat pad, you would have heard this neck adjustment. Sometimes students go with that answer as well. Used neck adjustment. But what did they say about neck adjustment? Neck adjustment did not help. That's what the patient mentions. Osteopathy, while she was doing osteopathy, neck adjustment was advised, but that didn't help. Now here, if that didn't help, will it match with this part of the sentence? It says that she used something which helped her to relieve the symptoms. So for that reason, neck adjustment will not be the answer, because if you can go back and listen to the audio, you'll understand that. But that didn't help her. That's what she's saying, neck adjustment. So for that reason, heat pad is the answer. And one more thing, while writing heat pad, it should not be written as one word. For instance, if you write heat pad continuously like this without space, then this becomes a wrong answer. You have to write it separately as two different words, heat space pad. Then again, like she's saying that after a few months, which means that she's talking about the further developments. Then describing a pulling sensation, like my head being pulled backward. She's saying that, so you take this, you understand, you have reached here. Then the next thing that you would be focusing on, some recommendation given by a doctor, very clearly physiotherapy was mentioned. Then she say a doctor comes and tell that her condition is spasmodic torticollis. So you reached here. Then here, this might be an area of confusion, like because it's very not explicitly being mentioned. So what do you understand from this question? Condition described as, that is, the patient is describing her condition as. You hear in the audio that, you hear from the audio that the patient saying that this doctor came and told that it's not untreatable, it's not treatable, it's untreatable, you'll have to live with it. So that, and she's saying that caused her depression, she was very depressed. Then another word sometimes student uses that, like unsympathetic. What the word unsympathetic, why was this used? Was it to describe the condition? This the patient is using to describe that health professional who told to her straight on face that this condition is untreatable and you'll have to live with it. So here you are supposed to describe the condition and not the healthcare professional. So for that reason, this is not the answer. The right answer here is untreatable. Then this, why I noted this June here is because when some students, when they see this word months, they have this tendency to write the name of a month. Sometimes some students write June here in that blank space. But what does it say? The subheading itself says treatment history from home. So here they are talking about the treatment. Some months off, which means that the patient underwent some form of treatment for a few months. So what was that treatment? Chiropractic treatment. That is what you're supposed to write here. Chiropractic treatment is what you have to write here. Some months off. So the answer would be chiropractic treatment. Okay. Then visited instead of 2 neurologists, a couple of neurologists is being said in the audio. That's what I said initially. You have to be open to synonyms. Then prescribed. When you see prescribed itself, you can be sure that you will be hearing a name of a medication. Baclofen was mentioned, that you can get it easily. Then joined ST group, that was also mentioned. Bought means get something for her. So that she's saying that she bought an orthopedic chair. Then an area of confusion which can come here is regarding the spelling of orthopedic chair. Some write it P-A-E-D-I-C. Orthopedic, P-A-E-D-I-C, or some write it just like orthopedic, P-E-D-I-C. Actually, both are acceptable. One is the British style and the other one is the American style. So both are fine, provided that you maintain the consistency. For instance, if you, for this question, for question number 7, you wrote the answer in this form, P-A-E-D-I-C, which is the British style. And probably there was another question after this wherein you have to mention the word color as the answer. And for that, if you write COLOR color, which is the American style, then you won't get marks for that. Because if you started off with the British style, then throughout you should be following the British style. Inconsistency should not be there. Okay. Then treatment using Botox. But in injection as such, they are not mentioning initially. But by hearing the word Botox itself, you can understand that that's a form of treatment. And then they are she's saying that like she had her first injection, then other doses of injection, okay, increase the dosage of injection. So definitely the answer here is Botox. Then side effects. Side effects is not being mentioned as side effects, but instead it's being mentioned as problems. I had some problems. Okay. So a swallowing difficulty was mentioned, that is there. Then supplemented by, so she said that apart from this injection plus some oral medications were given here. Instead of supplemented, the word that you hear in the audio is plus. Plus supplemented by means add on. So plus, it has the same meaning. Experience confusion. This I guess was clear. Had confusion and loss of memory. Now when loss of memory comes in, please don't write it as memory loss. It is always recommended that you have to write the answers as you hear it from the audio. So if you write memory loss or amnesia and all, don't write technical terms unless otherwise it's being mentioned in the audio. The audio is mentioned as loss of memory, write it as such. Then here is another area of confusion like morphine self-administered via. So this via is the keyword. In what mode, in what form or in what way it was given to the patient. Morphine was administered. So via is the keyword here which will help you in reaching the answer. So first they are saying that I was given a pump and through that like morphine was self-administered. So if you had identified via as the keyword, then definitely you would not have any confusion in identifying pump as the right answer. Okay, so with that we come to the end of this practice test. Hope you found this helpful. Stay tuned, we'll be back with more of such practice videos on OET listening. Now we had on part A. Like further we'll be having part B and C as well. So wishing you all happy learning. Stay tuned. Thank you.
MedCity International Academy. Trusted hands forever.